Okay. Hi. Hi, everyone. Hi, guys. Welcome back to Nursing and Therapy, and every other person here anyway. So, my name is Adaobi Okoye, and I'm a nurse. And I have two beautiful ladies with me here. And I remember saying to you guys that I'll be coming back with something very special, like a very important topic that every mother needs to know about. And everyone, like new moms, people struggling with some breastfeeding issues and stuff like that, would know about. And we believe that it's going to be very useful and helpful to people. So welcome back to Nursing and Therapy. Like I said before, my name is Adaobi Okoye. So I'll let the ladies introduce themselves. Please go ahead. Cynthia.
Hi, good morning. My name is Onyechefuna Mary. I am a wife before everything, a mom of two beautiful kids, a daughter, two daughters, yeah. And I'm also a registered nurse in US and in Nigeria. I'm also a certified public health nurse. Yeah, that's
Can you
about
see
it.
how my smile, how my mouth wants to see tear because I'm smiling? All right. Okay, we have someone else. Amaka.
Hmm. Hello, everyone. My name is Amadi Amaka Linda, AAL for short. Um, anyway, it's just my classmates who know me as AAL, Cynthia and Ada. They know what I'm talking about. First, I'm a wife. I'm a mom, a new mom, actually. I have a very handsome, lovely boy.
Oh.
Um,
Great.
I'm a registered nurse in Nigeria. I'm a registered nurse in UK. I'm a registered nurse in US. I'm a registered nurse in New Zealand.
Okay.
So,
Okay. All right.
Hey.
Keep it coming. Keep it coming.
so you can call me international nurse. You
That's
won't be
right.
wrong to say
Okay.
that. Anyway, that's just by the way. So I'm a registered nurse. I'm a mom, like I said. I'm practicing currently in the United Kingdom. I think that's about it, the basics, for my introduction and that. If there's anything else you need to know.
Okay. Oh no, I think it's okay for now. So, um, we have because I know that I saw a question on Facebook. Someone asked a question, and I felt was necessary, or it's necessary to actually discuss this because I realized that a lot of people don't know so many things about breastfeeding, and I'm not a mom yet, but I know that Cynthia is a mom of two, and Amaka is a mom to a handsome son, as he described, or as she described or explained. Okay, so like I won't want to waste much of your time. I mean, my audience, but I know that we're happy to have you guys here, and we're going to ask some questions and answer some questions, and. And as usual, you can always ask your question. We'll leave our social media, handles down, or even say it out for you to know and ask your questions if needed. So, and I won't like to waste much of your time. So we'll go straight to the questions, right?
Okay, go on.
That's right.
Okay. Okay. Okay, I want to first ask, what as a woman generally, I would say like how can you explain your experience, when you talk about labor and delivery? Cynthia, can you explain
All
maybe labor
right.
and delivery? Mhm.
So in theory, we all know labor, the different stages of pregnancy and
Mhm.
childbirth.
Mhm.
Um, so there are four. Okay, so from when the woman is pregnant to the childbirth and also the recovery stage. Okay,
Yeah.
so this recovery stage is the most important stage. I know every stage is important, but sometimes most people um pay more attention to the pregnancy and childbirth stage, right? But the recovery stage, which matters a lot to the all aspect of life of the mom and the baby, right?
Yeah.
So this recovery stage involves the contraction of the uterus back to normal, the lactation and breastfeeding. Okay, so and this stage for me personally, my recovery stage was somewhat challenging when it comes to breastfeeding. All right, so initially as a first time mom, I did not start lactating right away. Okay. So I had to, it was really stressful. Like when I think about it, I keep calling the nurses, oh, I'm not, are you sure my baby is getting enough food? I can't seem to be producing enough milk. I don't think I'm producing enough milk because I don't really, I wasn't so certain. Okay. I know I had the theory knowledge, right? But when it comes to, when it involves you, a different thing. The stress level is high, and you worry if your child is really getting enough. So it
Okay.
happened to
So.
me, and
Mhm.
yeah, it really happened to me, and I took some steps, and with the help of the doctors and the health practitioners, I was able to deal with it. So yeah, it was smooth, and it has this, yeah, it was fine.
All right. Okay. So, Amaka, do you have anything to add? Yeah.
Yes. Um, I'm a new mom. I have a 7-month-old baby, and he's actually my first. Like Cynthia said, we teach these things to patients like it's ABC sometimes, until I had my baby. That was when I knew that, I mean, it's better experienced.
Yeah.
You can't really say what it is with labor and delivery with being a new mom until you wear that shoe. It was after I went through it that I'm now like wondering, back home in Nigeria as midwives, the way we handle women in labor, I'm like, oh my God, I can't see myself being handled this way. That was when I understood what labor pain was all about.
Yeah.
But then you read it in theory, you don't understand what it is until you experience it. So it's the experience for me, it's different to different people. Some people have it easy, some people have it rough.
Yeah.
Personally, I can't say I had an easy labor. I first I had to, like, I passed my due date and all of that. So I was induced. So you know what
Okay.
induction is like.
Yeah.
So
And
basically, so basically, it's should I say it's personalized? People have
it
Yeah.
is
different
that
experiences.
it is.
Mm-hmm.
Some people have it easy, some people don't. And then
Amaka
post
is being emotional
delivery,
already.
you said.
I said you're being emotional already.
I think I am. And then post delivery, like Cynthia said, that's the most crucial part because that's when the woman is recovering. You need a lot of, especially psychological support. It is very important in that postpartum phase. So I'll just leave it at this, Ada.
Yeah, so okay, so generally based on what you guys have said, it's not just about the stages of labor. I mean, people neglect or ignore that recovery and lactation, yeah, that stage. So and that is what we are here to talk about. That's recovery and lactation, yeah? Is that not it?
Okay.
Yeah, that's it, yeah. And the struggles they go through because it's as much as well, not everyone is a nurse, but even nurses, some of them don't know because, like you guys said, it's something you have to experience it and
Experience. Yeah.
understand it. Yeah.
It's
So I
better
mean this
experienced.
yeah. So it's just we're just here to give you guys, I mean, some understanding, give you some information regarding this and what to expect, and then what you can do to help yourself to
Mhm.
especially when it comes to lactation, and also help your baby as well. Okay, so we're done with the first question. So we're going down to the other question. They're going to be very brief so that we'll save time. And so the second question is let me see. Um. So, what struggles did you have? Like, Amaka, you're a first time mom. So, what were your struggles when it comes to lactating? Did you say was it latching? Was it difficult for the baby to latch, like for the baby to breastfeed? Were you expressing like did you have milk production? What did you do?
At first, there was, I think this, most mom, if you ask me, most, but not all,
Hmm.
don't really start lactating immediately after giving birth. Some
Okay.
people do. Personally, I did not. But then it didn't take me the whole time. Some people, it takes them a very long time to start lactating. But I think for me, it was just about the second day that I
Mm-hmm.
started making milk. And then for my baby latching, it was a little bit of struggle, but it's not something out of normal
Yeah.
for a newborn baby.
Not to
So, but
latch.
then
Yeah.
thank God I had nurses. Like I said, these things are better experience. I had nurses, midwives there who like taught me what to do, how there are positions you need. There's a way you Cynthia, if you get you know what I mean. Like
Yeah.
you have to teach a baby how to latch. They don't learn it. You have to introduce it to them. So it's a process. They teach you that process, how you put the nipple on the nose of the baby to smell the milk, and then to quickly put the nipple into it's just a process. So for me, it didn't take me long, and it didn't take my baby long to latch as well.
Okay. All right. So, Cynthia.
Yeah, as I said before, it was quite a little bit challenging for me, right? Initially, when I was going there to have my baby, our plan as a family is to do breast milk, do exclusive. So we had that in mind and we plan on sticking to that no matter what, right?
Mhm.
So after the delivery and you see your child, like, some babies, they, after learning how to latch, right? And you see the baby is sucking out the milk, the baby is trying eating, like you see the baby is moving the mouth already latched, that's fine. But the anxiety comes in when this baby
Not
keeps.
making milk.
Yes, you think you are not making milk because your baby is always hungry, always, crying, always giving
Fine. Yeah.
the hunger signs. You see it, or you worry that this baby is not getting enough. Okay, so that happened to me. So I keep on worrying. Oh, my baby is not eating because this baby every 5 minutes, every 10 minutes, he wants to eat something, right? So I got worried at that stage. So, but I know that babies at that stage, at the newborn stage, their stomach is a size of a pea. The green pea, just a little thing.
Well,
Yeah. So it doesn't take much for them to get filled. All right. That's why they keep feeding frequently. So as a mom, if you are not aware of this, then the anxiety, the worry comes in at that point. You begin to worry. It's just for you to reassure yourself. Once your baby is eating, yes. Is the baby latch? Yes. You just gave birth. Your body already knows what it's supposed to do, and that is to produce milk. I know
yeah.
some people don't just start producing at the instantly. It has to take some kind of what's it called? Maybe some
But
massage,
yeah.
some try to
Yeah.
stimulate the milk, try to come up, try to do some one or two things just to help the process, right? But the body already knows what it's doing. It's gonna come. I know some people also have problem with lactating. I'm not ruling out that fact. Some people will end up not lactating and breastfeeding for one or two
Eventually, like
issues.
even after
Mhm.
manipulating, after doing all those
Yes,
things.
Yeah.
yes. Some people, I'm not ruling out that fact, but for the moms that can, maybe it's taking a while, or maybe they need to do one or two action to help stimulate the process. That is what I'm talking about, based on my
Mhm.
experience, right?
Mhm.
I had that experience, and it took me. Then I had to start expressing. They gave me the breast pump in the hospital to express. So expressing itself helps to promote the process. So before I know it, I started producing like 2 ounce. From 2 ounce, I went to 8 ounce. From
Are you saying that you're using that breast pump actually helps?
yeah, using the breast pump help to
So,
stimulate
so it
more.
stimulates the breast. Okay, okay.
Exactly, because it works as a demand and supply. Like you have to tell your body, oh, I need this, I
Yeah.
need this breast milk. You have to give me more. And the frequency of maybe your baby is eating, your
Using
baby start eating more, or you start expressing more, just to because at the
You know,
point as the
see,
baby
I think
grows,
the
the baby
breast
will need
pump
it.
too, it's more aggressive, than the baby sucking. So breast pump, it tends, like I said, it's aggressive. It gives you more milk
mm-hmm.
than baby sucking. So when your whole body is like, when that breast pump stimulates and the whole body is already used to producing more milk. So you find out that when the baby starts sucking, the baby doesn't need to struggle anymore because the breast pump has already like stimulated the whole body to like keep producing and producing milk, if you get. So
Yeah, but
it's also, yeah.
yes, but apart from the breast pump, even if because some people don't have access to the breast pump, right? So even
Mm,
if you don't have the breast pump, and to try to
massage.
massage, there are some food you can eat that helps promote,
Yeah.
you know, the
I was
process.
Okay.
going to mention
Anything,
that food part.
yes,
So
anything
sorry,
you can do
before we
just to
get
help
to,
it.
sorry to
Mhm,
cut you short. Before we get to the food that you can take to help produce milk, like to help with you lactating.
Mm-hmm.
Um, I know babies feed frequently, but I think I heard sometime that you should feed your baby every, is it 2 hours, every 2 hours, or what's the range? What's the time range based on your own country, Cynthia, and then based on Amaka, your own country, where you're practicing and what you were taught or told at the hospital.
mhm.
Cynthia, what you were told at the hospital as well. How many hours? What's the interval? What's the time range that you can,
So
feed your baby?
yeah, it's 2 hours. Okay, feed your baby every 2 hours. But for me, I know the theory will tell you what we are all
Mm-hmm,
professionals. We have to give you the information that is,
mm-hmm,
it's recommended by WHO. Realistic. Sometimes there is no general, so each person is different, right? So it's every
mm-hmm.
2 years. That's right. But some baby tend
Every
to
2 hours.
2 hours. I'm sorry.
Mm,
So the baby sometimes it has to be on demand, and when it's on demand, it's when your baby maybe you see the hunger signs, the hunger cues, and you know this
mhm.
baby you need to feed your baby. Then you pick up your baby and feed. Okay,
Okay.
if the baby has had enough, the baby will refuse to take it, and you know the baby have enough, and
Okay.
yeah.
So, Amaka, what do you have to say regarding this stuff as well?
But I think the 2 hours thing is like a WHO recommendation. It's
Mm-hmm,
not specific to any country.
mm-hmm,
It's recommended that you feed every 2 hours, but the thing is, like Cynthia already said, you feed on demand. You don't, some babies, you feed maybe every 30 minutes, every hour. Some baby might stay more than two. You find out there could be a time you still feed the baby, and then you see that, oh, it's over 2 hours. The baby is not even hungry,
mm-hmm,
So, but
mm-hmm.
the most important thing is feed on demand. That's what
Feed on demand.
breastfeeding is all about. Feed whenever the baby demands it, because when the baby demands it, nobody needs to tell you, you will know. The hunger cues are always there, so you just feed.
And so what I can understand from what you guys have said is one, after birth, or you have to do some things to stimulate the milk flow, like the breast,
Mhm,
and that's trying to breastfeed your baby through proper latching, like you said, and
mhm,
massage, and using of pumps, to
mhm,
help to
Yeah,
stimulate the breast as well.
yeah, I would like to add one more
So.
thing.
Mhm,
One more thing,
mhm,
sorry. So
mhm,
when it comes, because I'm emphasizing on the stress that it brings, right? When you
mhm,
think that you are not achieving lactation, that's I want to emphasize more on that. You don't There are some signs you see that will help you alleviate that stress, that anxiety that comes with that. Well, is your baby, there are signs that shows you that your baby is getting something, The baby doesn't. You don't have to right away. You don't have to start producing 2 ounce or
Mhm.
more of the breast milk. You can just start with just few drops. It's okay as long as you are producing something. That's fine. The baby is eating. Okay.
So what are those
So
what are those signs that you would see,
so
just like you
those
mentioned?
signs are some you seeing wet diapers. Is the baby actually swallowing when the baby is latched on? You see the baby, the movement of the throat. You see the baby is
Mhm.
actually swallowing something,
Mhm.
and you see the baby is getting, at some point you see your baby is getting weight later on, and you see your baby happy. Like you feed the baby for a while, you see the baby feed, and after a while you see the baby is okay, content, and sleeping happily. That's a good sign. Okay.
Okay. All
So
right.
yeah.
Okay. So Amaka, do you have anything to add on, this thing, or should we just go straight to the kind of foods you can eat to
Yeah,
help
let's
you?
go.
All right, Amaka, so we'll start with you now. So what are the kind of things one can eat, like a mom can eat, or what did you do to help you actually, to increase your milk flow and help you breastfeed well?
Um, well, I would start like I always say, different thing works for different people. But then we are practicing in the Western world. But we
Yeah.
know back home there are lots of things that our parents teach us. Like most of them are not recommended. But then we do them, and you see these things they work. You understand? So
Okay.
one of them I would say, first you need to be hydrated. Drink enough fluid. As a new mom, you need to be hydrated, especially warm water, like warm fluid. So but to
Warm.
make it, yeah,
Emphasis
warm.
on warm. Okay.
Yes, the warm water. And then
Okay.
you see that sometimes when you drink warm water, I don't know how these things work, but the breast milk just flows. So to make it easy, because you can't just continue drinking warm water. So it's advised that you do tea, make a hot tea, hot tap, stuff like that. These things, I can't say there's any scientific backup for them, but they do work. Trust
Mm.
me. Then there are also meals that could also help. Personally, like I said, I didn't have a lot of stress with lactating. But
Okay.
then I remember I had to like call someone back home, because it was just me and the baby. I'm like, that was the second day, after I had my baby. They said, oh, you need to drink palm wine. That she had palm wine. Cynthia, this thing sounds funny. There is no rationale. There is
But
nothing.
somehow it works.
Believe me, I'm just going to be honest. I took palm wine, and that it wasn't up to 30 minutes. The struggle of breast making milk and all of that was gone. And that was how my baby started breastfeeding. To be honest, I don't know how these things work, but they do. So
They do.
that's on they do, to be honest. That's on the feeding part. So you eat
Mhm.
things that are like pap, puddings, rice pudding, milk, tea, custard, all those soft food. They say
Mhm.
it makes there is no scientific rationale, but
Yeah.
believe me, it works. To be honest, it
Mhm.
works. So
Does.
that's just about it on the feeding part. You don't really need to do much. There's all this our hot soup, like insala soup,
Mhm.
those our new mom food.
Any
They
type of
also
hot soup.
so any type of puzzle, but our people will always emphasize on those our nsala soup. Some will tell you to eat yam. I don't know how yam makes breast milk to work, to flow,
Mhm.
but it does. So those are the little things you can do. But in all, generally, I think breast milk production is just your body responding. Can you guys still
Mhm.
hear me?
Yeah, we
Yeah.
can.
So it's just your body. The main thing, if you ask me, as long as your baby keeps sucking, that sucking reflex sends a message to the brain. That is what
Mhm.
really matters. This food and other ones are just like, the little bits and pieces you need to do. But the main thing, keep putting the baby on the breast. That sucking reflex send a signal to the brain to, oh, I need milk. So the brain stimulates, and then there is milk production. So that's just it.
Okay. Okay. I don't know if we have actually, I mean, I think we have discussed the important thing before we move to the next topic. So, or the next question,
Sorry.
sorry.
Well,
I don't know.
can I add something to this just briefly?
Yeah, sure, sure,
All right.
sure.
So I know we've already mentioned this, but we really have to emphasize we are on the importance of this. All right. So
Mm-hmm.
it is really important that you know how to, because the key aspect is your baby getting the milk, is doing the work of breastfeeding. Your baby has to lash well. So, and lashing well is the key, because if the baby keeps sucking and there is nothing coming out, like there is air, maybe this baby is sucking, your baby is getting more air than milk, the baby start getting gas and start getting cranky, and so you have to lash properly. If you don't know how to lash, you can ask your health provider or your health practitioner around you to teach you how to lash properly, to learn the different positioning ways you can position your baby to lash, and never worry about your baby. Maybe your baby is eating too much. On demand is the best, okay?
Mm-hmm.
Because also it helps your own healing, and it's also bonding. It creates the bonding, the mom and child bonding, by
Yeah.
body to so also when it comes to that, I know the mental state, you have to relax, take it easy. Anything that brings stress to you, it is not good for you at that time, because the most important person at that moment is you and your child, nobody else. All right.
Mm-hmm.
I know in the Western world, especially with immigrants that doesn't have much support system, it's
Mm-hmm.
hard, but find a way to relax yourself, eat good food, take it easy on yourself, and as long as your baby is getting fed, your baby is good, don't worry about anything. Get
And that
more
1 minute,
sleep,
please.
Yeah, that's
and
fine.
yeah, get more sleep, and that's try to empty one breast before another. Don't neglect any breast, because you
Okay.
might get
Yeah.
engorgement. Yes, you might
Engagement.
get
Yeah.
engorgement. So yeah, those are the key, and then the type of food you eat,
Mm-hmm.
and that's it.
So we just want to welcome our handsome boy.
Oh,
He's
that's true.
crying. I'm sorry, guys.
Yes, so
Okay, I'm sure he's happy to see us because he's been seeing different faces on the camera and he's like, what's happening here? Okay, so Amaka, do you have any other thing to add regarding latching, maybe how to latch properly, how to know
Yes.
breastfeeding?
Like Cynthia said, it's important to know how to latch, because if your baby is not latching properly,
Mm-hmm.
you probably end up with cracked nipple, because he will just be sucking on the nipples, you know. So
Okay,
the ba-
so when it comes to this, we have is it the areola? Yeah.
Mhm,
So how is it when the baby is sucking? Is it just
mhm.
the nipple or just both the areola, everything? So when you just
No.
explain this latching
So
thing
the
now.
thing is, some people, it depends on the size of the breast. They say the baby
Mm-hmm.
has the nipple down to the areola has to enter the baby's mouth. But if you have a big boobs, you
Okay.
don't expect the whole areola to enter your baby's mouth. But the baby will probably suffocate, you know.
Okay.
But the main thing is, let the baby not stuck on the nipple. The nipple has to go in to at
Mm-hmm.
the as well as the areola. Areola is black that black part, when you get pregnant, it tends to darken more, and
Okay.
sometimes it expands as well, So the baby doesn't necessarily have to have the whole areola into his mouth, but then the baby should, at least a part or a bulk of it should go into the baby's mouth. So this latching of a thing, like Cynthia said, it's been taught. It's not what we can, like, it's practical. I can't even demonstrate it here. So, but if you go through the process and the baby eventually opens the mouth, so you push in the nipple together with
Mm-hmm.
the areola, let it fits very well. So you have to like plug with the baby's mouth. The baby's mouth have to cover the areola. That's when you know the baby has properly latched. If that is not done well, the baby will be sucking on the nipple and it can be very painful. You
Yeah,
can
and
end up
also,
with wounds, you can end up with cracked nipples, So that's just one part of the latching. And if baby is properly latched, you see that on your own part, you will be relaxed,
yeah,
So
and also you have to rule out the fact that your baby doesn't have any condition that can affect
congenital
latching,
issues like all
all
these clear
those.
fluid.
Yes.
Okay.
So
Okay.
Okay.
yes.
Okay. All right. So I think we have actually, added, subtracted, divided. We've done everything to this for, I mean, to the best of my knowledge. I think we've actually, done well on this. We've done well explaining this lactating and how to improve breastfeeding and improve the flow of breast milk. So I want to go to another question. It's still relating to babies, but then it has to do with adding some solid food to the baby's food, like when you want to add some things, not just breastfeeding. I don't know if I should say weaning, but then
Introduction,
um,
solid
introduction. Yes,
introduction. Yeah.
Yeah, it's not
yes.
winning,
So
just
it's
introduction of
not winning,
solids.
yeah. Introduction of solid foods, yeah. So yeah, so winning is when you're trying to get the baby off breastfeeding, yeah, breast milk,
Mhm,
yeah.
mhm.
So introduction of solid foods. I just want to ask some questions regarding this, which is what are the kind of foods you can introduce to your baby? At what month would you start this introduction? And how do you prepare these foods? I just asked three questions now. The kind of foods you can introduce, or the best foods to introduce, at what age, and then the food preparation. So anyone can start. Amaka, you can start.
Okay. The thing is, WH will always go by guidelines.
Okay.
The guideline recommends that you exclusively breastfeed your baby until 6 months.
Mhm.
Exclusive breastfeeding means just on breast milk, no
Mhm.
water, nothing until 6 months. So after
Mhm.
6 months, that is when it is recommended that you start to introduce solid food. Okay, that
Mhm.
is the recommendation. However, like I always say, different things works for different people.
Mhm.
There are babies that no matter how much you breastfeed them, they never get filled up, you know. So there are babies, and then what about mothers who, no matter how much they try, there are women, even with all of this measure, use breast pump, eat this, and don't eat that, they still don't make enough. Like my mom will always tell me that she never makes enough milk. So that she always had to compliment us with pap.
Because
So,
you ate too much when you were little. You ate too much. You.
and I don't behave yourself for this life. Hey God.
He's
So
laughing because she's letting him laugh.
So that's well, the thing is, you can introduce solid. It is safe. It is safest, I would say, to introduce after 6 months of breastfeeding exclusively. However, personally, I will say what I did. I didn't introduce at 6 months. I introduced solid earlier than 6 months. But then the thing is, whenever you want to introduce solids to this baby, remember that these babies, their stomach are very little, their intestines are not well developed. So
Mhm.
if you want to ever give them solid earlier than 6 months, just make sure that it's as watery as it can be, to aid digestion. And then you introduce one at a time. You don't just boom, rush baby. You just give a little and see how well it's tolerated. Then little by little, little by little, you can start, you know, introducing the food. Maybe later you can increase the consistency. That's the thing. Oh,
Mhm.
wait. Let me see if I
Okay.
can give him. Is it? I'm sorry, guys.
Yeah, it's
Um,
okay. babies first, right? They are our priority. So do
So
what you
what
have to do.
you can
So
excuse yourself if you have to,
yes,
Amaka. Yeah, it's
Okay,
okay.
yeah.
Go
okay.
ahead.
So from what my colleague AAL have been saying, right?
Mm-hmm.
The WHO made their own recommendation. As a matter of fact, when I went for my checkup for my baby mom and baby care, appointments, so the doctor said at 4 months you can start introducing food, which is what Amaka just said. That is right. The recommendation is 6 months. Okay, I did. She said that, but I still did 6 months by
Yeah.
choice.
Mm-hmm.
Not that the baby, nothing will happen to your baby if you start at 4 months. But we'll always tell you what the WHO said. But you do what works for you. But
Exactly.
we encourage you, if you can do 6 months, do. But if you cannot do it, you can start at 4. But anything
Mm.
below 4 years, 4 months old, it's not
It's not
advisable
safe.
because
Yeah.
it is high risk for your baby, and
Yeah.
your baby's organs are still trying to get to the right, right
Mm-hmm.
place.
More like developing,
Yes,
stronger,
yes,
getting
developing.
stronger together with the
And
immune system. Yeah.
those are the reasons why you have to stick to what is recommended, because these are based on research and
Mm-hmm.
things that are
Would you
these
say
things that
evidence
can
based?
be,
Yeah.
yes,
Mm-hmm.
evidence based, yes. So we have to stick to that. Um and also the food, the kind of food you give to your baby also matters a lot. For example, you have to give, as my colleague also said, you have to give one food at a time. It is said to be one food, you do one food a week to rule out um allergies. Also,
Allergies. Yeah.
yeah, to rule out allergies, and to also give your child's GI, digestive
Time.
system, time to get used to, it's a new baby. And some people now, what is in vogue now is the baby led, the one they say
Weaning.
baby led
Yeah.
weaning.
Baby
For
led
me,
weaning.
it's, yes, for me, they have their reasons for doing that, because it gives the child some sense of independence. But it's also, its own, it has its pros and cons. But for me also, I never bring myself to do that. I don't know. I'm not comfortable doing that. But that is not what
What
we
did
are
you call
teaching
it?
now.
Baby led what?
Baby led
Weaning.
weaning. Like you give a
Winning.
baby a whole stick of drumstick.
Carrot.
Yeah, or a whole carrot, the baby walk it out him or
I'm still
herself.
I'm still not
Yeah.
comfortable myself.
Yeah.
I'm still not
So
comfortable with that,
exactly.
you know.
Exactly. So
Okay.
Because
yeah.
the
So
baby
the
can
way,
just swallow a chunk, and it's hard for him to chew. And if somebody
yeah.
is not, although they say you have to do it supervising the baby,
Yeah.
but
Yeah, as
then
I said, it has. I'm not coming against the baby led weaning. They have the reason why they do that, and it shows its benefits and also its disadvantage. So whatever
Mhm,
works for you, you can do it. So the food you give your baby has to be a light consistency, because the gag reflex um might not be as developed. Okay,
Mm-hmm.
so
mhm.
you have to be to avoid choking and
And yeah, to also need
yeah,
you need sorry, Cynthia, you need to also watch out for constipation when you are
exa-
introducing solid.
exactly.
Because
So
my
you have
baby
to make it.
struggled with that as well.
Exactly. So, and also, since you introduce food, you have to get introduce water to make it easier for the baby. All right. So all these measures, the food, as I said, I'm also a content creator that also shares recipes on how to make it convenient to your baby, to the
Mm-hmm.
food you give your baby in the most convenient way for you as a new mom, and while traveling, how to pack the meal. So yeah.
Okay. All right. So let's get. I don't know if Amaka has anything to add, but I mean, let's get straight to the food. I know we call them. Is it purees? Yeah.
Yeah, purees.
So I don't want to make this video that long,
Okay.
or so I know, but you can just maybe briefly just tell us one or just few things you can use to make such purees like baby foods for the babies. If you get what I mean, yeah. So
Mhm.
just tell us what we can use, what you've been using, and the baby has been kind of going well with it. So tell us what we can use to make such purees. Just because we don't want the video to be so long, so just
So
few words.
Ada, first for me, I started with our native pap. We all know what pap is,
Okay.
and you
Mm-hmm.
make it very watery. I started at 4 months, exactly at 4 months, with
Mm-hmm.
watery pap, and then at 5 months, I increased the consistency of the pap. I made it a little bit thicker than what it used to be. So aside pap, I think it's also safer if you want to introduce. You could start with things like fruits, purees, like carrot purees, pear purees, all those like that can easily be digested. Then I started off making them separately. I did carrot puree separately, banana, avocado, at 5 months. So I was doing them separately. But then I found out that my baby was tolerating them very well. I started making like a combination of one and two.
Mm-hmm.
You could also do potato, mashed potato, like blended potato, blend it into a puree. I
Mm-hmm.
made potato. I could do potato with carrots. So what the thing is, I tried to, because breast milk is balanced for the baby. So whatever a solid food you are introducing to a baby, you should also try to, as much as possible, try to make it balanced. Ensure that at least it has the protein, it has the minerals, it has the carbohydrates, as much as you can. So you could do, for instance, I'll just give this one example and then I'll leave Cynthia to talk. You could
Yeah.
do potato, but when you're doing the potato, like we all know, is carbohydrates. You could add pear, the fresh, is it peas, not pear, peas, the fresh green
The
peas.
garden peas.
Yeah,
Okay.
you could either you use the peas or you use the carrots in place of the peas. Either of them
Yeah.
serves. You could also there's this deboned fish that we have here. You could use the boned fish, and then blend all of them into a puree. You could also, instead of using the fish, I could use this milk, normal baby milk. That's protein enough. So it just depends. But the most important thing is make it as soft as it can be, and then introduce one at a time. Observe your baby, and please with enough water. If you want to introduce anything before 6 months, give enough water to avoid constipation, because constipation could lead to intestinal obstruction and other GIT
Yeah.
issues in the baby. So I'll
Yeah.
just leave it at this. Cynthia.
All
Okay.
right, just you've said it all. I just want to add just one tiny bit of thing because of time. Um Also, when doing I know, as you said, you can get mixed, but sometimes what I see on social media that a lot of people share, it's sometimes funny. You see people adding cabbage to orange
Goodness
to
me.
all types of things that can actually
Wow.
cause a lot of problems for the baby. You have to try as much as possible to avoid gassy foods. You can
Yeah,
add onion to baby's puree. You can add
yeah,
cabbage to baby's puree. Like, I see that, I was like, is this for real? So you have to pay attention. The goal is to make this food as balanced as possible. The way you eat your veggies, the way you eat your
yeah,
protein, the dairy, the way you eat your, very balanced. Okay, so at the right proportion, that is the goal. You can put vegetable, spinach, you can put potato, you can put, very nutritious things. You can put meat, chicken, blend it up. Baby is human, right? Okay.
yeah.
So the difference is that you are making it puree. Okay,
Mhm.
but there are some food you have to, avoid, at least not at this stage. As for example, you cannot give a baby honey. Okay, you cannot
Honey.
give a, yeah,
Okay.
at that age until 1 year old.
Yeah.
You
Okay.
see some
So
people
you could
add honey to
substitute
baby's
it
pap.
with other sweeteners, like maybe dates.
Yeah, you
Okay.
can add dates, but baby doesn't
Mhm.
really, because some of those food have their natural occurring sugars. Okay,
Sugars,
Yeah.
the
yeah.
baby, or if you teach your baby how to have sweet tooth at that stage, it might be hard for you later. So the baby, or you just need to let it, the natural occurring, unless it's the pap, like pap is bland, right?
Mhm.
The milk also has sugar in it. So it's not like sugar, it's sweet on its own, the baby milk. So you can add dates to the baby's milk if it's not sweet enough. That is why it's not good to make your baby get used to sugar at
Yeah.
sweet things at a very early stage. Then that baby becomes picky. Okay. So yeah.
Okay. Is there any other? Okay, nothing else. Yeah. Any other thing? I've actually, to be honest, I've been listening and I've actually learned a lot as well. So, um, I think we've done it all. I don't know if there's any other thing you guys want to actually add before, like, before regarding this breastfeeding and baby food options. But let me also add before we conclude. Let me also add that Cynthia here has like a Facebook channel, or not, yeah, a Facebook page or whatever, where she prepares different things for babies, for adults, um different dishes. So, and her name there is Cynthia Onyechukwu as well. So you can, if you need to learn anything, if you need to learn food for your babies, or even to ask her some questions, just go to her Facebook, go on your Facebook and chat her up. You can see her videos as well. She has lots of videos. She has lots of things to give out to give out share regarding generally cooking, because I know she likes cooking. So, and I know this might be like, it's, should I say it's off the topic, but I also want to say that Amaka is a gold lady. She deals on gold. She deals on gold. She has her own health department as well, like health unit as well. That's
Yeah.
Junak Health. What's that again? So
Junat's Healthcare Agency. It's on Instagram.
Junak, yes, it's on Instagram. Junak Healthcare Agency. But then she sells gold, like quality. I mean, from it's Dubai gold, like this, Saudi
Wow.
Arabian gold.
Why
So
am I hearing this for the first time?
yes, so she's a big woman.
Wow.
So I don't know, like, before we come to the final end, do you guys have any other thing to say, to add, based on this topic, before we end the video?
Well, for me, as a new mom, being a new mom is challenging.
Mhm.
So try as much as possible, for anybody who is going to be listening, maybe expectant mom, new moms, explore every help available that you can get, especially for those of us who are in the Western countries here who have very limited support system. Explore
Yeah.
any help that you can get. It's challenging, trust me. And then, try to make research as well, because sometimes I listen to, like, there are some things I did for my baby that I found out myself. Nobody taught me. And then when you are speaking to other moms, they're looking at you like, what are you saying? So they don't know these things. Some people are just, I don't know the best way to put it, but just make research, find out new development, find out new things, don't just explore. Give your baby varieties, baby are human beings,
Or you
like
can
Cynthia
consult
said.
your pediatrician or your
Yeah,
gyne. You
exactly. Just
can
try to
consult a
know what
professional.
is best for your baby. And if you get stuck, at any point, contact your health visitor, your doctor, anybody, to get advice from a professional point of view. So that's just it,
Okay.
really, Ada.
Okay. So, um, Cynthia, do you
Then
have anything to say? You wanted to
try
say
to help
something?
yourself with your mental health, because being a new mom can be mentally challenging. Do things that make you happy, once in a while.
Yeah.
Go out, take a walk. Sometimes we find ourselves getting lost in this whole thing of being a mom,
Mm-hmm.
but just try as much as you can. Just like, I know it's off the
You
topic,
are
but then
important too, just as your baby, because it takes a
exactly,
healthy
but
mind
you
to
need
make
to be
to
okay
help
to look
another
after
person.
the baby. Yeah.
Yeah,
Yeah. Okay.
yeah.
So, in summary, um, as a woman, you get pregnant, become a wife, become a mom, and you have a baby, you have to be careful or take note or take care of your recovery. And looking at lactating, you have to do some things to see if you can lactate. That's massages, using of pumps, and most importantly, like stimulating latching. Your baby should latch well to help with the breast milk flow. And then as much as WHO has recommended 2 hourly baby feeding, and the best thing is to feed on demand. I'm actually trying to
Yeah.
summarize what we said. And then regarding, and when you feed on demand, you have to see the signs that your baby is feeding well through, I mean, looking at the throat, like you guys said, the when baby swallowing, and the diapers, um, how happy the baby is, not always cranky, something like that. And then regarding baby food, making purees, you have to be careful, as you can decide to start. The recommended time is 6 months, but people can do 4 months. Like it's like you said, it depends on the situation. So but while making the purees, you have to be the hygiene is very important. We didn't mention that. Very important, extremely. We can't even overemphasize on hygiene. And while making it, give lots of water. Since you've already started introducing other foods instead of breast milk now, just breast milk. So give lots of water and try to make the consistency of the food kind of, should I say, fluidy, something not too thick. Yeah. And then
Lighter.
yeah. And most importantly, introduce one at a time. Don't push everything together, and make it balanced. Yeah. Then as well as what else is that again? Watch out for allergies, constipation while doing it. Okay, so we've come to the end of this
Device isn't
this
set up yet.
video. To thank everyone for joining us, and as well listen, share, ask questions. You can ask questions. You can go to Cynthia's page on YouTube and Cynthia, ask any questions. Go to Juna Healthcare. I always forget it. What's that
It's
again?
Junak Nursing and Healthcare on
Yes,
Instagram.
on Instagram. So Cynthia is on Facebook as Oniship Cynthia, Nursing and Healthcare, Junak Nursing and Healthcare on Instagram. Ask your questions. And then also on YouTube here. My name is Adaobi Okoye on YouTube. The video will be there, put up on YouTube, and on my, if you listen to podcasts on Spotify, Nursing and Therapy. So we'll be back again. We're going to come back again to give you guys something else you want to hear. All right. So take care, enjoy the rest and the best of the season,
Yeah.
and have a beautiful day ahead.
Happy
Bye,
Thank you so much,
holidays.
everyone.
Ada, for
Bye.
having us. Bye. Merry
Thank you.
Christmas.
Merry Christmas.
Merry Christmas.